Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. Our show is dedicated to safe and effective ways of naturally treating um, all sorts of medical problems and diseases. I want to thank, as I always have to do because it's the right thing to do, my two sponsors. The first sponsor is Promolife. Promolife, as you're going to learn why it's so important to this show, as well as my many other shows. This one is dedicated to sarcoidosis. Promolife makes home care as well as medical ozone generators. If you have sarcoidosis, you're going to learn why doing home care ozone can be very beneficial, particularly if you can't get intravenous ozone therapy, as you're going to learn about it when we get there. Having said that, um, you can go to their website at promolife.com, promolife.com, and look at all their different medical, and home care devices and supplement, ozonated oils and things to take. So you'll have an idea of what they do. But then when you're ready, call 888 742 3404. That's 888 742 3404. Tell them you heard about it here on Dr. Howard's show, and they'll do something special for you. And you'll understand what we mean by that when we get into the show on home care and discuss home care ozone therapy. I also want to thank, and boy, is this important for your problem, doctorsbiome.com, doctorsbiome.com. Doctor's Biome is a very special probiotic beverage that repairs the gut. It puts 15 patented proprietary strains, and this is the catch, living probiotics. They're not in a capsule, powder, and tablet form that's been freeze dried into that method, powder that they can make and shove in a capsule or compress into a tablet or just sell as the powder itself. And by that freeze drying process destroys most of the living bacteria because they're supposed to be living. And then what happens is when you take it, 90% of what might come back to life is destroyed in the stomach by the stomach acids and then bile salts in the small intestine. Well, Doctor's Biome has created those 15 proprietary strains to survive the stomach acids over 90% while they're living, and thus they can get into your colon because they're also called not just next generation probiotics, but next generation probiotics, but they're also called smart probiotics. And smart probiotics are actually created to stick to the wall of the gut, the wall of your colon. So they can get yeast in balance and aid in digestion and also get rid of bad bacteria. As you've learned on other shows of mine, and you should subscribe, please do that. And you will find that the gut connects to everything, every organ and every system in your body. And that's why it's important to take Doctor's Biome every day. But we'll get more into that as we get into the show. So let's get right to it. So we've talked about many of what's called the rheumatoid or autoimmune diseases on other shows. And sarcoidosis is another one of them, or it's classed in that, of chronic inflammatory diseases, of the autoimmune diseases, where you get tiny clumps of cells called granulomas, and they can form in different organs and on tissues in your body. It's most commonly found in lungs, though you can find it in your lymph nodes, your skin, your eyes, or all your joints, and it causes varying amounts of symptoms when it gets there. It's also found, believe it or not, in the brain, the liver, the kidneys, virtually every organ in your body. I'm not going to go into all the symptoms of it because I'm not here to teach you like I used to do years ago on my shows. I don't need you to help you self-diagnose. If you have sarcoidosis and you're listening to this show, you want to know little bit more about it, and most importantly, how to eliminate it, hopefully permanently, completely, once and for all. The reason I am not discussing and or using the word cured is because nobody really knows what causes it. If you don't really know what causes it, other than there's an autoimmune problem, then how can you say you cured something? Okay, so I use, instead of the cure, the C word, cure, I use eliminate, hopefully, ideally, permanently, completely, once and for all. Because depending on the organ and system that it's affecting, you can have varying symptoms of it. Um, it's not contagious, at least you know that. Um, there's, it's diagnosed through X-rays and CAT scans and blood tests and lung functions. Biopsies can be used to determine, the confirm the granulomas and everything. There's a lot of foods you can take for it. Okay. When I say take for it, not for helping it, but for getting rid of it or slowing it down. Um, Basically speaking, in terms of food, you want to eat all organic, of course, ideally, if you can, but you want to get things that boost your immune system. Um, Berries loaded with antioxidants and whatnot to boost the immune system. Of course, anything, vitamin A, vitamin D, vitamin E, vitamin C 5 or 6 times a day, and you take as much as you can without upsetting your stomach. Please don't buy cheap vitamin C. And sometimes, unfortunately, expensive vitamin C is garbage. I can't mention brands because I don't want to cause lawsuits over it, but I do have my opinions as to which brands and which things are a little bit more beneficial. Trying to fix myself, make myself look a little better. Okay. Um, all the cruciferous vegetables are very good. Broccoli and cabbage, um, uh, green leafy vegetables, all these things are good when you have autoimmune diseases and you want to boost the immune system. Of course, ideally more raw food. We've talked about that on shows in the past. These are all good. And you want to avoid highly processed foods, fried foods, foods that contain excess salt. Though sea salt is good because it has all the trace minerals, and you should put those trace minerals back into you. It's very important to get trace minerals, and if you're not eating foods that contain sea salt, you should add sea salt to your diet. Be careful with vitamin D, however. You want to take it, but you don't want to overdo it because it seems to worsen some of these problems. And of course, you want to don't intake foods that are extremely high in calcium. Um, you want to take moderate amounts of calcium. Now, what's interesting, you see, with calcium, the body utilizes as much calcium as it needs, and then it'll urinate the rest away. And that's, if you have too much calcium, it can cause kidney stones. Calcium oxalate kidney stones are the most common. In addition, the calcium can help form some of these granulomas, some of these little sarcoid tumors. So you want to keep that to a minimum. If you don't have enough calcium, your body is going to draw it out of your bones, you see. So it's an opinion of mine. I don't know that there's been any studies to prove this, but if you're not getting enough calcium and still develop sarcoidosis, where is that extra calcium coming from? You'll probably find that you have osteoporosis to some degree. And that because the body has to maintain a normal level of blood calcium. So you don't want to overdo foods and supplements that have calcium in it. And you don't want to underdo them as well. You always want to have some amount taken in every day. So there's where vitamin D, I think taking 5,000 IUs a day is more than enough and the most you should probably do with this. presuming you don't get a very good diet otherwise. Um, but turmeric has been shown in um, and magnesium, I think, as well, to help with all of this. Still, none of this is getting rid of it. So what do you do to get rid of it? Well, intravenous ozone therapy. Now, if you go to my podcast called Intravenous Ozone Therapy, Everything You Need to Know, it tells you all about what ozone does, all the different methods, why we use the three most powerful ones. They're all not created equal. So to say, oh, I did ozone therapy for my sarcoidosis, it didn't help. You might have not been getting the better method. It's like taking the wrong antibiotic for an infection. So yeah, maybe it helped a little bit, but it didn't really get rid of the infection because it wasn't the right antibiotic to take. The same thing goes for ozone therapy. Um, you have to have the right method to get the right amount of medicine in you in the right way to get get the benefits of it. And when ozone enters your blood, it does many different things. But here, what we're looking to do is destroy those tumors, those cysts, those sarcoids that are causing all this organ damage. At the same time, and we don't know exactly why because there's no research that went into figuring it out, it seems to right and rebalance your system. And by righting and rebalancing all the different systems in your body, you're not going to create excessive problems and that would lead to autoimmune issues happening. We have seen nothing but great success in treating sarcoidosis in our office here in Manhattan over the years. Now, what if you can't get IV ozone? Is there any other way you might help yourself? And the answer is yes. And by the way, it's only not the blood methods of ozone, but the direct intravenous ozone therapy that's done the most good for sarcoidosis. That's where we inject the oxygen and ozone gas directly into the vein. And we've done that over 385,000 treatments in the last 30 of my 35 plus years doing ozone. And obviously proving not only its benefits, but its safety. So yes, don't be worried about if it's been done in our clinic or by some doctor that I trained. If they're following their training the way I teach them, then you should have nothing but success. And the key word is safe. You don't want to hurt anybody. I take Dr. Do No Harm very, very seriously. You may not benefit somebody, but you certainly don't want to hurt them. And of course, you want to use the method that's going to give you the best result and the fastest and safest result. And that's where Robin's method of direct intravenous ozone therapy has been proven to be those things. Having said all that, home care is where you would be doing rectal insufflation, which is basically an ozone enema. I've done a show on home care ozone. You might want to listen to that podcast. But basically, with rectal insufflation, you would get a machine from Promolife, tell them that you want to get set up for home care a la Dr. Robbins. You'll have to get oxygen because you want to get a medical grade oxygen tank from them and get it filled locally, which may or may not be a problem depending on where you live. All right. And then what you do is you get set up and you do an ozone enema. First, you wet yourself. You got to wet your colon wall by doing a fleet enema or get a bulb syringe with purified water or distilled water and you squeeze it in and clean yourself out. The cleaner the colon, the better absorption of the gas will be. Of course, it's not the same as IV ozone therapy. You're only going to absorb a small amount, but you still want to do it safely. And then with their machine, they sell you bags that you can fill up these special bags with the ozone gas. You attach what they'll sell you or what you can buy are these little self catheters. That little plastic tube that has little holes at the end, rounded, just like a rectal thermometer, and about the same thickness. So it inserts easy. You wet it with vegetable oil, and then you gently insert it into your, through into your your rectum. Oh, is 3, 4, 5 inches if you can get that much in. And then you lay on your back with a couple of pillows under your buttocks because you want to lift yourself so you're tilted backwards. Remember, ozone, or you don't know, is heavier than air. So we want to get it to go back as far as we can into the colon. And then you squeeze some from the bag and you close the bag. You hold your buttocks tight, you relax. Then you open it up and keep repeating until the bag empties. I don't like to give exact concentrations out, but keep the concentrations low. Okay. I'm not your doctor and I don't know you and you don't know. So I can't make more specific recommendations to do things safely. But if you kept it at a 20 microgram concentration, and you'll see how you do that on those home care things, how you set it up for that. But in and around a 20 microgram concentration, it's a safe level to use for virtually almost everyone, including children. Okay? And that can be done twice a day, both in the morning and in the evening. All right. So that's another way, in addition to intravenous ozone therapy, that you can move things ahead quicker. By itself, I don't think it's going to get rid of the problem. But there is no doubt in my mind, based on our clinical experience over all the years, that it can make a major difference. Everything else that you're going to do for it, everything else that you're going to do is only to make it more comfortable to live with it or to minimize the symptoms. What we're talking about here is how to get rid of it, hopefully permanently, completely, once and for all. Is it possible with home care ozone therapy, rectal insufflation, that you can get rid of it that way? Yes. It would be surprising if it does, because while it's a wonderful way to do ozone, when done correctly and safely, never directly from the machine into you, but always filling up a bag and slowly squeezing it in, of course. But it without a doubt, it'll help. It should help improve your problem. So if you have any further questions about this, feel free to contact me at Ozone Doctor. I'll be hopefully able to answer them. I have to be careful answering questions to treat people who aren't my patients yet. OzoneDoctor@yahoo.com. That's all spelled out. OZONEDOCTOR@yahoo.com. You can also call my office in Manhattan, and they'll get you through to speak with me. And that number is 212-581-0101. That's 212-581-0101. Now, if you want to contact Promolife again to get set up for home care, Promolife.com is their website. But if you call them and tell them you heard about it here on my show, they always seem to do something special, give you a percentage off or something for free or whatever. That number is 888-742-3404. And you absolutely positively have to go to doctorsbiome.com and get a month's supply of this. Now, I'm going to tell you, it's not a cheap probiotic product. So if you use my patient coupon code, which I'm now giving out to all my listeners, Howard35, HOWARD 35, you'll get 10% off the retail price. And if you go on auto ship eventually, you can get another 10% off, a total of 20% off. Of course, it comes with free shipping and a 100% money back guarantee if you don't like it for some reason or can't use it for some reason. So go to doctorsbiome.com and absolutely buy that as soon as you possibly can. Everybody, thank you so much. for listening. Please subscribe to my channel. There's plenty of good podcasts here to listen to. And if you don't have a problem now, someone you know and love may have that problem in the future. So let them come here and start listening. You won't be sorry. Everybody stay healthy, stay safe, stay well. Bye-bye now.